Okay, shall we start? It's the graveyard shift. Thank you so much. I'm very pleased to be here, my first ICSA conference. And I was coming, so I sent an abstract and it was accepted. So I'm delighted to be able to present. And I think I'm the first psychiatrist ever to attend one of these conferences, which is very easy. I think that interdisciplinary MDT approach is really important. Yes. And I don't consider myself an expert in cults. I'm not a researcher. It's 25 years experience being a consultant psychiatrist. And it's an area that I'm interested in for two reasons, which I will come to. I'm sure you all heard of Rod and Linda. I had invited them to our academic program. I'm really interested in promoting and cultic research amongst all mental health professionals. Now, who are these people? I'll give you a clue. This is outside the psychiatric conference in Edinburgh. Yeah. So the reason I'm interested in cult is because cult became interested in me. And as a junior psychiatrist, sort of wet behind the ear, I went to my first ever psychiatric conference. And I saw these people, and the hatred and vitriol was quite incredible. And so I wanted to know why these people dislike psychiatry so much. I mean, we're doctors, we're in a caring profession. We treat severe mental illness, which is very disabling, people who are very vulnerable. So one of the reasons I'm here is because of my learning and research about the Scientologists. And so these are the three questions that I will try and answer in my presentation. So this is the outline. I think that kind of history of psychiatry is important. That kind of anti-psychiatry movement that Scientologists have latched on is important. Then another movement on the molecule with particular focus on neurodiversity as well. And also I will talk about lifestyle medicine and placebo. And those of us who are not mental health professionals, I think this is very relevant because what we've learned from the anti-psychiatry movement, we now see it in this kind of anti-cancer treatment. I mean, anti-vaxxers. I mean, it's kind of the rule book, the playbook seems to be similar. So just two cases very briefly. I had a patient with psychosis who we were admitting under the Mental Health Act, which is a coercive way of admitting someone in the UK. By the way, I'm a psychiatrist. I work in UK, in London. So we did a home visit with the police. We had a warrant from a judge. And he basically showed a paper and has signed this paper saying that he's refusing involuntary treatment to a psychiatric unit. And I said to him, well, actually, this is the law of the land. The Mental Health Act is nothing to do with me or you. It's an act of parliament. So we have to admit you according to this legislation, but you have the right of appeal. So if there wasn't the influence of anti-psychiatry or Scientologists, this guy felt less shamed, less stigmatized, and more likely to seek mental health treatment earlier. Second case, I think about involuntary patient, someone who had visitors on the ward, and they happen to be Scientologists. Obviously, patients can have visitors. Unfortunately, he didn't influence the case too much. She had the right of appeal, which she did, and he actually came back to the unit to work as a volunteer once she was discharged. So yeah, we have measures in place that we can prevent this kind of these vulnerable patients being protected. By definition, if you have a severe enduring mental illness, you are vulnerable. So this kind of cultic forces are more likely to influence you. Within the Mental Health Act, one of the previous speakers talked about this case, Amina, if you were here, someone who was treated in a culturally insensitive manner. I mean, in my 25 years experience as a psychiatrist, we've had one case similar to that. By far, the majority of patients who are admitted really need to be admitted. And we want, I mean, I'll show you a graph later on, but psychiatric units have reduced since the times of government. And the one problem we have in the UK is that we have shortage of beds. A lot of families are really desperate to have their loved one admitted, but there are no beds available. But I mean, I personally think mental health act should go. It does more harm than good. And that mental capacity actually should be used for all patients to admit them. if they lack capacity and to coerce treatment. So if I have cancer and I don't want treatment for my cancer, if I have capacity, I can say no. Similarly, all psychiatric patients, if they have capacity, you should refuse to have treatment. I think that coercion should be limited. One problem here is that, if you close then all psychiatric hospitals, as they have done in Italy, for example, then patients end up being street homeless, end up in prisons, and end up in police cells. So we do need psychiatric hospitals, and just some level of coercion is required. Now, why psychiatry? Why not cardiology or oncology? I mean, this happening. I mean, happening now with lifestyle medicine stuff that's being promoted through various. There's good, but yeah, I think stigma is huge here. And as a psychiatrist, I felt that when I was a medical student, I wanted to be a psychiatrist. Don't ask me why. But you get this funny look. Why don't you be a shrink? Even within the health, even in medicine, we are marginalized. And I think that's kind of stigma by proxy. So stigma affecting mental health patients does affect us as well as professionals. And we have therapists here or social workers that they might have experienced that as well. And we do label cult leaders and ideologies as paranoid, psychotic, antisocial. So we use this terminology, which should also explain why cults dislike us. Interestingly, Scientologists have their own method of treating patients. This is, I mean, it's not evidence-based, and the profession, all therapists have basically shunned the method of auditing that they use. My understanding here is that they're competing for the same group of people that we try and treat. They try and recruit for their organization. These are patients who are very vulnerable. But the phased approach is really crucial. If there was evidence that this worked, we would use it. But they have their own reasons why. They're anti-psychiatrists, yet they have their own treatment methods for patients who are very vulnerable. So there's stigma. So you can imagine someone with a mental health condition, they want treatment, they want care, they feel scared. And they think, psychiatry is 50 years ago, it's 100 years ago. It's one flew over cuckoo's nest. I'm going to be given ECT with general anesthesia. And then they Google search and they come up against Scientologist methods. So that delays the treatment that these vulnerable patients require. And this is an organization linked to them, which again, it's I think in the article you can Google search online, and there've been a lot of complaints regarding addictive disorders. They're very vulnerable and are exploited. And yeah, so this is a unit, Narconon UK, it's a rehab center. So again, what's unique about psychiatry? Medicine was barbaric. A lot of patients, some of our patients lack insight and capacity. There's risk of harm to self and harm to others. Stigma by proxy. And we serve it syndrome discipline. Everything. Target, health, and psychiatry movement. And there's that kind of demand supply mismatch as well, which is worldwide. There's a waiting list for mental health treatments at the moment, which doesn't help. There's delays treatment and more likely for a patient to go to these other organizations. So again, very briefly, when asylums were set up, they're a place of sanctuary for patients because there was nothing before that. And then they gradually started closing down, mainly because of invention of chlorpromazine, the first antipsychotic, and is in the top 10 most important inventions in medicine. And then there was this critical anti-psychiatry movement, and Goffman's work was in the 60s. It's more than 60 years old. And that contributed to closure of many hospitals. And I mean, we kind of here now, and Goffman, did his work around there. So, I mean, the problem right now is that there's a shortage of beds at the moment. So we seem to have gone to the other extreme. And if you close down all psychiatric units, where do the patients go? In America, they might have American colleagues here. A lot of prisoners have got severe enduring mental illness. And this is where I used to work. It was an asylum that was got a clock tower there. And it's all partly, be glad to know, so nice buildings now in southwest London with a few psychiatric units that are very high in demand. Now, there is the asylum there, the government's work. Again, I tell all my trainees and all mental health professionals who read this work, because they're kind of critical. We always have to praise what we do. We have to critically evaluate everything that we do. And I actually consider myself a critical psychiatrist. I mean, one of the main issues we have right now is with overdiagnosis, with over-medicalization of mental health problems. I think psychiatric medications are overprescribed. I don't overprescribe it, but if I don't give a medication, then patient could go to another psychiatrist who is more willing to prescribe. But I mean, these are real issues, the effect of big pharma as well. But yeah, so the work of these people, I mean, that's Thomas Sachs and that's Lang. They're psychiatrists who turned against their profession. And they have a sociological understanding, socio-political understanding of wellness. People who are different, treated, they're ostracized because they're different. And it's kind of resurfacing that kind of anti-psychiatry movement as anti-medicine right now, anti-vaxxers. And we have these kind of gurus who advocate various treatments for cancer and all ailments out to the mainstream. And yeah, so one problem with closing down psychiatric units is that you have more patients in the community and more likely to be violent. And the violence perpetrated by psychiatric patients is more random. So some innocent people could be affected by it. It's very rare, but unfortunately it can happen. And when it does happen, it's headline news. Oh, you psychiatrists, you didn't do a good job. Look, some innocent guy was killed. And if you have huge asylums and put everyone away, something like that is a rare event, but they're less likely to happen. So as psychiatrists, we feel like we're kind of stuck in the middle here, between a sort of a rock and a hard place. And these are some more recent cases. I mean, you may have heard of it on the news. This is sort of headline news in the UK. The chap on the left is a diagnosed a person with autism, and he went on and murdered children. In fact, he was known to the Prevent program in the UK, which is extremism focused. Well, because he was an extremist, they discharged him. The chap on the right is someone with paranoid schizophrenia, not mental health, killed 3 people randomly. Yeah, again, highlights how relevant stigma towards mental health patients, to the profession, and something that cults can take advantage of. And yeah, so I think the public has this kind of love-hate attitude towards shrinks as well, about these really smart cookies or cannibals. It's like about their murderers. And psychiatry has been abused. The term sluggish schizophrenia was used by the Soviets to describe people who are against communism in China recently. And also, there's a really good, interesting podcast there. I would recommend everyone listening to it, how CIA used medication and drugs at the height of communism. And the psychiatrists were involved in using these hallucinogens. And more recently, I'm originally from Iran. There was a case about a year ago when 2 young girls were mandated by a judge to have family therapy for not complying with compulsory hijab rules. And the head of the Psychiatrist Association, it's a very brave thing to do, published an open letter criticizing the judiciary, saying that, well, this is wrong. You can't, politicize, this is not a mental health condition. Now, this is the main psychiatric conference in Berlin a few years ago. And if you read there at the top, it's like psychiatry, fake science, real harm. German psychiatry, murdering back then, still torturing now. Just imagine going to a major conference and this is what you see. I mean, basically, they're comparing psychiatrists to Nazis. And these are, again, to the Scientologists. They had the tent in Berlin, and I went inside, but I didn't tell them who I am. And I looked around, and they basically, they're saying we're Nazis. Just the vitriol is really incredible. The kind of ideology they have, one of their pillars is anti-psychiatry. Now, I'm happy to debate anyone who's got anti-psychiatry, has the evidence-based academic approach to it. But I mean, you can't debate ideology like this. Now, moving on about some of the mental health indicators that could predispose someone to join a cult or be influenced by cult. So these are some of the symptoms: emotional instability, low self-esteem. We know that that mental health trigger could lead them to join a cult for that kind of, for help, for support, um, craving for structure, social isolation, spiritual searching. So, I mean, these are not necessarily abnormal. We all have these to some degree. But people with mental health condition are more likely to have it at the more severe end of the spectrum. And these are some of the psychiatric diagnoses that could be related to these symptoms: depression, psychosis, and also neurodiversity, which I will talk about. So we talk about this push and pull factors and executive dysfunction that can predispose someone with a mental health condition to become a cult member, be influenced by cult, when they're quite vulnerable, when there's a huge waiting list, when the stigma associated with getting help, that there's a fear, oh my God, I'm going to be locked away, I'm going to be injected with horrible drugs. And then this is, people can take advantage of this. So I'm going to move on and talk about autism now, which is my my specialist and interest areas. Water first. So I'm going to focus on neurodiversity now. On the right hand side, obviously, the most famous level 1 autistic spectrum person we know. And us who are Breaking Bad fans, Jesse Pinkman, I'm convinced, has ADHD, adult ADHD. And his teacher, Walter White, tells him to apply himself. And one of the common presentations, so from one of the common things that patients with ADHD are told by the teachers is they need to apply yourself. So I'm going to talk about neurodiversity now. Now, I also, I'm consulted regarding extremism. This is an area, I mean, we cannot discuss individual cases. In the UK, the two commonest form of extremism is Islamic, followed by right wing. And we looked at how people who are neurodiverse are more likely to be influenced by extremists who have an ideology. So this ideology is the cornerstone of extremism. And we talk about these push and pull factors and executive dysfunction to describe the people who end up as extremists, end up on forensic services, and then they get referred to us for an assessment regarding whether we think they have adult ADHD and autism. And again, this is a small sample of people. It may not represent, it probably doesn't represent patients that, or people you see joining calls. It's very small. It's so small that we cannot say that neurodiversity is a risk factor for extremism. And I mean, I'm very careful about it. I mean, my own daughter is neurodiverse. The last thing I want personally and professionally say that, okay, it's a real nightmare finding a school for her to say, oh, she's a future extremist risk. However, it does form a framework for us to understand why extremism happens. I mean, the question for me was why someone from a Muslim background, second generation, raised in the UK, living in a free country, democracy, free education, healthcare, they will pack their bags, go to a place they know nothing about, and do these atrocities. And I think it's this mental health symptoms, including the neurodiversity, is about best for us to understand why this happens. And those of us who are assessors of autism and ADHD will know some of these symptoms. And I advise all clinicians to learn about diagnosing adult ADHD and autism. And as an example, I mean, so executive dysfunction, that poor decision making, so pull and push factors. So someone with autism, with ADHD, for example, instant reward seeking. So they may read an article about making a bomb, and they suddenly decide, okay, I have to make this bomb now, without really thinking about the consequences. They go online, they Google search, and everything we do online is being monitored. And before they know it, police comes under the door, anti-terrorism squad, and they're arrested and convicted for searching how to make a bomb. Similarly, if you have a restricted fixed interest that people with autism have, it could online, you could go down this rabbit hole that you end up as an incel activist, for example. People who have autism, molecular social anxiety disorder, have difficulty forming relationships. And so they go online and say, "Oh, I'm an involuntary celibate person. I want to have a relationship," but it's the women that the misogyny develops out of that. And I'm also addiction psychiatrists are very much incorporate the addiction model, looking at how this small group of patients think and operate, and that kind of behavioral addiction is very common in patients who are neurodiverse. And there's a lot of overlap between autism, ADHD, and comorbidity. A lot of patients have substance misuse problem up to 50%. There's a lot of anxiety, depression, OCD. And again, I've kind of really highlighted some of the evidence here. 1 in 4 prisoners have ADHD in the UK, perhaps more. So that kind of impulsivity, executive dysfunction puts them in trouble. They end up in prison. We have cases of psychosis that are more likely to be risky. Again, that's if linked with substance misuse problem. And I mentioned that there's a lot of substance misuse also with adult ADHD. So these are individuals, up to 4% of UK population have adult ADHD, and they tend to self-medicate initially with drugs before they get help from a specialist. So this is a kind of a risk triad that we need to deal with. So you have people with ADHD and autism, more likely to have a mental health disorder, more likely to have addiction. This is a predisposed group of individuals who have significant mental health issues, and they're so comorbid with each other. And this is where the cult influence comes. And it could lead to potential forensic risks here. So they get recruited, they become fundamentalists, they do things that, are absolutely awful. Does that make sense?
Yes. Yeah.
I can't think from top of my head, but we can have a chat about it later. But yeah, that kind of impulsivity is one feature we see, and that kind of obsessional focus on one thing, which could be something really mundane. It could be Coca-Cola cans, or it could be baking a bomb. Again, this I'm trying to highlight that this group of people, homeless people, are vulnerable. These people have mental health problems, likely be street homeless, and likely be exploited by cult. And this is, if you haven't seen the Netflix documentary on Rajneeshis, it's I think it's, again, you're the experts. Yeah, I think it's a very good documentary. And they basically went around cities in America, and they got loads of people who were homeless, who have had mental health problems, substance misuse problems, and they brought them to their commune to vote for them. So this is a safeguarding matter.
It was the brashies.
You should definitely talk about it. Definitely talk about it. So we go for a drink afterwards. Yeah. Okay, now, what do we do to prevent this from happening? Well, prevent mental health people who are vulnerable from going down that rabbit hole, becoming extremist, undertaking doing violent things, and not having proper mental health treatment. So there's a prevent strategy in the UK. It's the Home Office in the UK that funds it. So it's a criminal justice arm of UK government. And although they're doctors, they're clinicians, the idea is to prevent people who are more vulnerable with mental health conditions undertaking extremism. That's what they do. So it's a safeguarding strategy for possible extremists, which in the UK are the right-wing or Islamic. So that's one strategy we have. I think to help these individuals, I love evolutionary theories of psychiatry and medicine generally. And it's about natural selection, sexual selection, and also group selection increasingly. So we operate in groups, and as hunter-gatherers, it was group survival that was more important than individual survival. And these groups need to have shared beliefs and values and ideology. And but my sort of understanding, my take from an evolutionary perspective, is that we have these human instincts that's very important to us: sense of belonging, sense of meaning, sense of survival, and functioning and working in groups. And a charismatic cult leader can come up with an ideology and sort of hijack that, and then use and abuse that individual for their own purposes. And I won't spend my time on all these psychological predispositions. We all have these. There was this talk about agency, the cognitive biases of so many cognitive. Again, these are more prominent in those who are mentally ill, more vulnerable, and can be exploited. Now, what to do about this? So the problem is that there's stigma in psychiatry. We're disliked by patients. They're less likely to come for treatment. If someone breaks their leg, they definitely go to hospital. But their mind breaks, they're less likely to see a mental health professional. So what's the strategy? What do we need to do? And there was a really excellent talk this morning about, lifestyle stuff that's being, because it's not evidence-based. I urge you to go to the British Society of Lifestyle Medicine website. So these are clinicians and professionals who are looking at a holistic way whereby psychiatric patients can be treated without too much focus on therapy or medication. It's by changing the environment, by eating well, social support, stress management. And these are some of the techniques that a cult would use. You get that kind of love bombing. You feel wanted in a group. Stress management, yes, a yoga technique, Pilates, meditation, all that, it's a way of reducing stress and better and nutrition. So I think if we focus on lifestyle medicine as an important gateway into treatment for our mental health patients, they're less likely to feel stigmatized and marginalized and come to a mental health specialist for help and support when they're very vulnerable. And I went to this this exhibition for academic purposes. I wanted to know, again, as called specialists, I heard that we need to engage with the other side. We need to, talk to them, think about, learn about the ideology. So I went here and basically, that did some field work, find out what happens at this. I mean, some of the stands were quite wacky. And you see, it was pseudo-religious and cult-like stands here. And it was quite scary. About meditation, about, I think there's things about UFOs. There were tarot card readers there, mediums there. And potentially someone who's quite vulnerable, mental health problems, there's a waiting list, there's a cost. Oh, I'll go to this exhibition. I'll have Reiki or whatever treatment that is, quick, and it will help me. And so what I did, I tried to break that down into what is evidence-based and what's not evidence-based. So when manipulation is not a great word that I've used here, it's physical manipulation. So movement, relaxation techniques, eating well, sense of belonging. So these are some of the things that cults can potentially use to bring someone into their organization. Now, if as mental health professionals, we use this as to front load our services, I think it's a good way to destigmatize the treatments that we provide. And it's a huge field here. A lot of our patients smoke and drink. A lot of patients eat really unwell. So if we can enforce that kind of lifestyle medicine stuff that's evidence-based, we take these patients away from all these kind of alternative gurus that can be harmful to them. So we need to think and learn how the other side operates. And placebo effect, again, it works. Placebo, a lot of the interventions that are offered, what is the sort of authentic lifestyle gurus, it's like a placebo. Reduce cortisol, increase oxytocin. When you're in a group, when that love bombing makes you feel well because you feel welcome. And we need to embrace how placebo can help with a psychiatric patient. Nocebo is the opposite. I mean, the medication that we prescribe legally, we have to say about, explain what the side effects are. And that has a negative effect. Whereas if someone goes to a Chinese practitioner or they don't tell you about the negative effect, just the positive effects. Or this will cure your cancer, this and that. Again, about this from British Society of Lifestyle Medicine. Now, this is what we do really badly. As a doctor, I don't ask questions for my patients regarding if they believe in afterlife, in reincarnation, this existential stuff that's really important. And I mean, we have therapists here. I don't know whether a therapist might ask something like that, but this is really wrong, because this is a very important question to ask. And in modern Western medicine, it's not something that we consider. So I think we need to show interest in what patients believe in a non-judgmental way. Now, it could even be really crazy from our perspective. The worldview could be really, I mean, it's not for me to judge if someone believes in UFOs. I'm there to help that patient who's potentially vulnerable. And again, this lifestyle medicine is so important in terms of getting our patients to be more active. A lot of poverty causes mental health problems. Just helping our patients with everyday life, everyday living can really be beneficial. And these are the main pillars. I mean, you have to be a rocket scientist to sort of apply some of these to your patients. In terms of social connection, eating well. I mean, 90% of stuff in a typical grocery store, you shouldn't eat. Something like that. It is. But when you think of it, there's so much sugar, so much fat, sleeping well, and minimizing. If you just focus on this, then we can, improve the well-being and health of our patients. And again, this is something I got from my own experience. We need to make our hospitals and clinics more homely. A lot of Europe, being to a psychiatric unit, it's not therapeutic. It's not pleasant. In UK, almost all inpatients are sectioned under the Mental Health Act. They feel terrified. They feel traumatized by the process. I mean, we're not there to traumatize patients. We're there to help people. And yeah, I mean, this kind of spiritual care. I went to a recent conference, and these are all health professionals. So they have license, their policies and safeguarding measures in place. And they talked about what spirituality means to them. One of them talked about Jesus Christ. The other one talked about a shaman ideology. And again, if horses for courses, if that really helps patients to get better, why not just have that discussion with our patients? Like a spiritual history taking and just focusing on getting patients moving, going out, socializing, exercising, meditating. So these are things that cults potentially use to recruit people into the organization. Why not health professionals? Why can't we use this and then guide patients into, next level up care, which could be medication, could be therapy, could be admission, could be detox. And the cost of healthcare is an issue. In UK, we have National Health Service, but the waiting list is significant. So if we can reduce the waiting list, I think it's a really important. So it's someone who doesn't have to wait 2 years for an ADHD assessment. And if they have that early intervention treatment, they're less likely to turn to harmful organizations. And I'm going to finish by talking about AI. I mean, I'm a convert here. I believe that kind of that digitalization, automation, AI will completely revolutionize healthcare for all of us. We'll be able to talk to an app. It's on my mobile here, and it will basically do the initial assessment, the triage. So it will make life easier for all of us, and it's scalable. So anyone could download a proper regulated health app. And I work for Psychiatry UK. And we're a telepsychiatry service. We see about 10,000 patients per year, per month, sorry. And this is a kind of the patient journey we have, and we use AI throughout. And my target is to do a complex psychiatric assessment in 10 minutes. I think it's doable with technology and AI. And if you imagine, you can see so many more patients that way. But if there's an ugly side, I think as professionals, particularly cult specialists, need to be aware and be mindful that AI agents could be used by recruiters, because already there are these algorithms, and it's got a rabbit hole that people who put vulnerable could go down. The last thing you want is a digital twin of a guru who would just as an AI aid that will talk about all this stuff that is used for recruitment. And the commonest reason AI is being used is therapy, organizing life, and finding purpose, which is something that, joining a cult could actually give that individual. Okay, so hopefully I've tried to explain and answer these questions that I have set myself to do. What do we do to prevent this? I think stigma-free mental health treatment is important. Lifestyle medicine focus, individuals, holistic care. And if someone has a spiritual belief, belief in alternative medicine, we shouldn't just dismiss it. We should engage with the person. We should understand it, and then just guide them. I said, well, actually, this is complementary. Yes, do have your coffee enema or whatever, but also have treatment for cancer, which is there's evidence that you get cured with it, and also better safeguards. Doctors have safeguards in place, so it's really important to have these safeguards. That's me.